Hi everyone, welcome back to my channel. So a mother brought her child to the hospital recently, and this baby had a high fever and a bit of a rash. By the time the child came to the hospital, she was already contagious. Guess what? She was diagnosed to have chickenpox. By the time that child had gotten to the hospital, she had distributed the viral infection, to a number of her siblings and the adults living in their house. So we're going to be discussing about chickenpox in children today, the symptoms, the management, as well as how to prevent it. But before we dive right into this video today, please, I am begging, I don't have shame, subscribe to my channel, click that red button, hit the notification bell so that when new videos come out, you are alerted. And please like. When you like my videos, you don't get a viral infection. Please, if you have anything to talk about, if there's anything you want me to talk about, questions you have in your heart concerning one medical ailment or the other, or you want me to treat that issue, please write it in the comment section. I will address it. And if you want me to make a video about it, please go ahead and indicate. So let's dive right into the video. Thank you. So in this video, I will be providing you with the causes, symptoms, treatment, and prevention of chickenpox in children. Chickenpox is a common childhood illness, and it is caused by the varicella-zoster virus, which spreads from person to person through direct contact or by breathing in respiratory droplets from an infected individual. So it is highly contagious, especially during the first few days before the rash appears. So if your child is exposed to someone with chickenpox, there's a high likelihood that they may contract it as well. And this is how chickenpox is transmitted. The most recognizable symptom is the itchy rash that appears on the skin. However, before the rash develops, children may experience a fever, headache, and general feelings of discomfort. The rash starts as a small red spot that quickly turn into fluid-filled blisters. These blisters can then be incredibly itchy and may spread all over the body, including the face, the scalp, and even inside the mouth. If your child has chickenpox, there are several measures you can take to alleviate their discomfort. So first and foremost, once the rashes have become fluid-filled and blistered and has spread around the body, make sure their nails are short to prevent scratching and potential, infection or infection spread. If the child is much older, encourage that child to wear loose clothing for comfort's sake. Loose, breezy clothing, because tight clothes can actually irritate the rash and increase the feeling of itching and irritation. For younger children, just have them in their underwear. A cool environment would help with the inflammation and itching. Then apply calamine lotion, or you can use oatmeal baths. What do I mean? You just take ground oats, and then apply it as get them to soak in it, and it can also alleviate their discomfort. Also remember, parents, never give a child aspirin, as this can lead to Reye's syndrome, a serious condition that can actually damage their liver and brain and could lead to death. So aspirin is a no-no. Now, in most cases, it's a self-limiting illness, that is, it resolves its own by itself within a week or two. However, there are situations where you need proper medical intervention, and it becomes necessary. If your child's fever persists or becomes very high, you need medical intervention fast. If the child's rash appears infected, that is, begins to look whitish or yellowish, or if your child has difficulty in breathing, it is essential to seek medical attention immediately. Now, a healthcare professional will then prescribe antiviral medications that will help shorten the duration of the illness and, most importantly, reduce its severity. Now, for preventive measures for chickenpox, for my own school of thought, it's always best for the child to just get infected, let the child get infected with the chickenpox and the child is immune for life. On the other hand, the most effective way is through vaccination. The chickenpox vaccine is usually safe. It's actually safe and highly effective and provides long-lasting immunity against the virus. It's usually administered in 2 doses. The first dose starts between the age of 12 to 15 months, and then the second dose is given between 4 to 6 years of age. The vaccination not only protects your child, but also helps prevent the spread of the disease to others, especially those who are vulnerable, such as babies, infants, and individuals with weakened immune systems. In addition to vaccination, there are other simple preventive measures you can take. Encourage your child to washing their hands regularly with soap and water for at least 20 seconds. Teach them to cover their mouth and nose with a tissue or their elbow when sneezing or coughing. It is also important to keep your child away from school or daycare if they have chickenpox to prevent further transmission to their peers. Remember, always consult with your healthcare professional for proper diagnosis and treatment. And that will be all for today. See you in my next video. Thanks for watching and stay healthy. Bye.